Patient is a 45-year-old female who presented to the ER with chest pain for the past 3 days on and off that radiates to her right arm and jaw. She has hypertension and hyperlipidemia that is regulated by metoprolol, exercise, and diet. The patient is allergic to penicillin with a skin rash presenting after administration. Nurse has identified patient's learning style as a combination of visual and auditory. Upon discharge, patient will receive a handout and verbal education regarding medication to treat her chest pain.
Knock, knock. Hi there, my name is Christina. What's your name?
Julie.
Nice to meet you, Julie. I'm going to be your nurse while you're here in the ER today. So can you tell me what happened?
I've been having some chest pains, like pretty significant chest pains, and it kind of goes down my arm and then into my jaw.
Okay, and how long have you been having those?
About 3 days.
Okay, and is there anything that makes it worse or makes it better?
No, it just kind of comes on sometimes.
Okay, and do you have any illnesses, like chronic illnesses that you take any medications for?
I do take medication for high blood pressure.
Okay.
And then I do have high cholesterol too.
Okay. Do you know the name of the high blood pressure med that you take?
It's, I don't know, it's really common. It's like a low pressor.
Okay, low pressure, yeah,
yeah.
okay, yeah, that's very common. Now, do you take anything else? Any, like,
No, I don't
birth
take
control or
any.
anything?
I do take that, but I don't take anything for my my cholesterol or
Okay,
anything.
so how's that regulated for you?
I just really try to do like diet and exercise, and that's been working pretty well so far. So.
Okay, that's great. And do you have any allergies to medications for our records?
I do have a penicillin allergy.
And what happens when you take that?
I just kind of get a rash.
Okay, so okay, that makes sense. Yeah. Okay, so what we're gonna do is we did draw some labs and triage, and so they turned out really, really normal. So what the doctor's gonna do is he prescribed you a prescription for nitroglycerin. Have you ever heard of that drug before?
No, I've never taken it.
Okay, so basically what it's for is what they found that you probably have is you're probably just having like poor blood flow to certain parts of your heart, maybe due to your high blood pressure or high cholesterol.
Okay.
So it's a medication that's what's going to do is it's going to allow those blood vessels to kind of open up, those arteries to open up and be able to push more blood out to your heart and back into your heart. So we're just going to kind of go over some information about that drug. So can you tell me what's the best way that you learn?
I'm kind of like I do okay with talking, but if I see something, I retain it a little bit better.
Okay, great. So we have a bunch of kind of things that I'm going to print off for you, but I'm going to go over them with you right now.
Okay.
And then when I get your discharge instructions, I'll hand that to you when you go.
Okay.
So nitroglycerin, what it's for your chest pain. So when you feel that, what I want you to do is take a seat first, take one tablet, wait 5 minutes, see if the symptoms go away. Take another tablet only if the symptoms have not resolved themselves.
Okay.
And then if after 2 tablets the symptoms haven't resolved themselves and 10 minutes have passed, then take another one.
Okay.
Does that make sense?
Yeah.
Okay, so in total you can have 3 tablets in 15 minutes.
Okay.
And so if the first one resolves it, then you don't need to take another one. It's fine. But if by 15 and you've taken 3 tablets and it's not resolved, we want you to call your doctor or come to the ER for sure. Okay? Some other things that we want to always remember, bring it with you places if you're concerned about something like that, because it is going to be an oral tablet that you just stick under your tongue. It's rapid acting, it acts super fast, but it can only be administered under your tongue, okay? We don't want you swallowing this medication because it's not going to work as fast. It's just going to be absorbed into the sides of your cheek and your membranes, so it's going to be much better if you just take it that way. So some other things that you need to know for medication-wise, I don't want you, if you change medications, Lopressor is an okay medication to take with nitro, but if you change your high blood pressure medication, let your doctor know you're taking nitro, just because it can have some interactions with other high blood pressure medications, and any like allergy medication, some antidepressant medications. So you just want to let your doctor know what kind of meds you're on. Okay.
So anytime I add or change anything, just let them know.
For sure. Yes, exactly. Some symptoms I want to make sure that you're aware of is sometimes your heart can start to beat really fast, and that's just a side effect of the medication. So Lopressor, the medication that you are on, is going to already help with that. But we do just want to make sure that, again, if you change it, that an increased heart rate is a side effect, and that's one of the reasons why you want to call your doctor. Another reason to call the doctor with some of these side effects is if you have hypotension, so that's basically low blood pressure from your normal baseline.
Okay.
So your normal baseline is 112/82, which is a great blood pressure today. So what I want you to do is if it goes too low, go ahead and call your doctor, because that can also make you really more easy to be dizzy, pass out. Sometimes you can even get severe headaches from this med. So that's also another reason to call your doctor. Anything that's out of the norm of something that you can't handle, also that might be another reason, because we might also need to try potentially a different form of the medication if that isn't working, if the side effects for that is just not working for you. Some other things that we need to talk about is storing your meds. This med is very sensitive to light. So you want to keep it stored in a dark container, in a dark cabinet. Avoid opening it too many times or for unnecessary reasons. So to look at the pill, or just to maybe you think so. Just really try to only open it when you're going to take one. Don't store it in other containers like plastic containers or metal containers. Make sure that it definitely isn't mixed with any other medications, because all of those things are going to decrease the effectiveness of the drug. Does that make sense?
Yeah, so just keep it by itself.
Yeah, exactly. And I mean, I know you're not a male, but if your husband tends to have chest pain, make sure if he's on any Viagra or anything, so any erectile dysfunction med, just because that can cause an issue for him. And so, I mean, I don't want you to let him take your medication, but I do want to let you know about that, just because that's super important. You can also, if the headache happens, you can take some Tylenol with it. And see if that doesn't relieve it, you can then you can for sure call us. If you have any blurry vision, it tells you right here. Any blurry vision, shortness of breath, cold sweats, you definitely want to be seen here as soon as possible. And if you take yourself, someone takes you, probably would almost be the best idea. Yeah. So do you have any other questions for me right now?
I don't think so. I think you taught it pretty well. So.
Okay. So what I'm going to do is I'm just going to ask you a couple of questions just to make sure for my knowledge and for your church knowledge and just for your knowledge to make sure that you've really understood kind of what we went over today. So can you just tell me three things that you would need to call your doctor? Three side effects you need to call your doctor for.
It'd be if I was dizzy or had a headache.
Yeah.
Since I do monitor my blood pressure with my other medications, so if my blood pressure is lower than it normally is, I should call. And then again, if my heart is beating really fast, and I notice that, I should also call.
Okay, great. Well, if you don't have any questions for me, I'll go ahead and go print this off, and you can go ahead and get changed, and we can go.
Okay.
All right. Thanks.
Thank you.